Parkinson's disease is a degenerative condition that affects your dopamine-producing cells in your brain, where you have loss or destruction of those cells, and so you don't have as much dopamine, which is a natural neurotransmitter or chemical in your brain that helps control your motor functions. Some of the early signs and symptoms of Parkinson's include actually a loss of a sense of smell, constipation, and acting out your dreams at night, or sometimes what we refer to as REM sleep behavioral disorder. Some of the initial symptoms that usually bring patients to me include tremors, or mostly a resting tremor of one hand or leg. Also slowness and stiffness of movements, usually affecting one side of your body. Parkinson's diagnosis is still very clinical. We take your symptoms, the history of progression, and your exam that I do at that visit to diagnose Parkinson's. There is no special testing, although there is an imaging test called the DAT scan, DAT. It's a nuclear medicine type imaging test that helps to differentiate Parkinson's disease from other neurological conditions that can cause similar symptoms. As a movement disorder specialist, I'm trained to program DBS, or deep brain stimulation surgery, that's done for different motor symptoms that a Parkinson's patient may be suffering from. And so they would get the surgery done with a neurosurgeon, and I would be programming their device after they're done. I also do botulinum toxin injections for different symptoms affecting Parkinson's patients. Lastly, I also program Duopa pump, which is a medication infusion into the small intestines, and that helps with a lot of motor symptoms that Parkinson's patients may suffer later on in their disease. The great thing about Christiana Care is their level of support of developing a comprehensive care center for Parkinson's patients. I have access since joining here to a social work, neuropsychology, a close relationship with the different specialists like physical therapy, occupational therapy, speech therapy, and I give educational talks throughout Delaware to local support groups and other physicians trying to expand the education and care of Parkinson's patients.